Only through suffering do we learn. Aeschylus. The unexamined life is not worth living. Socrates. Nothing is so firmly believed as what we least know. Michael de Montaigne. In the United States, despite damning revelations about the damage done by these policies and the brazen dishonesty of government officials, politicians still seem to be basing their approach to the pandemic management on how they think it will play with voters. The problem is that without an honest accounting of these errors, akin to how authorities examine a plane crash for lessons to avoid future crashes, the lessons of this pandemic will be written by leaders who designed those poor policies. That means that lockdowns, school closures, masks, vaccine mandates, censorship, and panic are still very much in play as part of the official template for future pandemics. Professor Jay Bhattacharya, Stanford School of Medicine, and Professor Martin Kulldorff, Harvard Medical School. Hi, I'm Frank Speidel, a retired emergency physician and recovering hospital administrator, and welcome to The Doctor's Inn. The program intent is not to practice medicine or provide medical advice. With the help of our guests, we hope to provoke respectful, informed discussions of healthcare to the benefit of our community. In December of 2020, less than 12 months after the COVID-19 virus genome was published, in the U.S. we had begun to immunize our community. In a January 2021 episode of The Doctor Is In, The Great Oz Has Spoken, Dr. Rosica was the guest and discussed in detail the inconsistency in policies on in-person schooling. In that show, we reviewed published reports that overwhelmingly indicated children were not the drivers of COVID transmission and that there was harm in keeping schools closed. The effect of the science was like chanting Urdu at an avalanche. We continue to experience arbitrary rules such as a 6-foot separation for return to class with no basis in science. We saw classrooms deep cleaned and scrubbed when 2 students there were reported to be COVID positive. Yet no COVID transmission from fomites has ever been reported. While communities, with the best of intention, embrace science-free responses, many individuals with significant careers and credentials in medicine and epidemiology warned that in the summer of 2020, schools not reopening for in-person education would have significant harmful and residual effect on the students. I am happy to welcome back to the Doctor's Inn Dr. Beth Ann Rosica. In December of 2020, Dr. Rosica stunned me with her comprehensive familiarity with the medical literature. She was and remains a tireless advocate for arguing for the return of children to in-person schooling. She warned of significant adverse results to the prolonged school closure. Dr. Rosica, welcome back to the Doctor's Inn. And what did I get wrong?
I don't think you got anything wrong, Frank. Thanks so much for having me back on the show. Always a pleasure.
How did our children fare from the response to the pandemic with the closures?
Well, honestly, Frank, I think that of all of the misguided policies that were enacted during COVID, the impact on children was the most significant. And I think that we are going to feel the dire consequences of those decisions for years and years and years to come. I honestly fear that we will have a lost generation of children as a result of these misguided policies.
Are there some numbers to match up with this?
Absolutely. I mean, first we could look at academic performance. So number one, we have seen dramatic decreases in competency and proficiency in reading and writing and math for all children, but particularly for our most vulnerable children. So those children who lived in urban areas, in poor areas, are minority students, we're seeing dramatic declines for those children that I really do fear that they may never come back. There have been a number of studies done looking at actuarial science. So that's what insurance companies use to sort of predict what the mechanism is for what they're going to have to pay out over time on claims. And using an actuarial model, they're really predicting that the earning potential of young people who were in school during these lockdowns is going to be significantly diminished. Children, when they become adults, are going to earn significantly less money than they would have had they not had to deal with the school closures. So that's just one very small piece. I mean, you could argue, okay, so you make $10,000 less a year, what's the big deal? Well, for a lot of people, it's a really big deal. But even more importantly, the mental health crisis that we have seen and continue to see, to me, this may be the most significant issue. And it's very multifaceted. So let's look at kids were told from a very early time. I mean, I go back to Children's Hospital of Philadelphia, one of the premier children's facilities for medical services in the country. And prior to COVID, you would take your child to the pediatrician there, and they'd have on the wall a little guide on how much technology time should children have. And, starting at a young age. And it was never, even at the teenage level, screen time less than 2 hours a day. That's what they told you every single time you went in there. Well, what we have seen, and they were part of the problem, if you recall, during COVID, CHOP was very much, their policy lab was very much against reopening schools. And so their philosophy of children shouldn't have a lot of screen time went right out the window, because then children were not only on screens all day for school, sitting in their houses, they were told they couldn't go outside, they couldn't play with friends, they couldn't do anything other than sit in front of a screen and communicate with their children. So we are seeing a huge impact on the mental health of children because of the amount of screen time that they're spending. And there's a really interesting book out that's called The Anxious Generation by a gentleman, yes, John Haidt. And he did a phenomenal job of laying out, and this was even prior to COVID, the advent of the smartphone and how it is really rewiring our children's brains and the skills that they are not developing as a result, yes, of not having to communicate in person and develop real and meaningful relationships. So I believe that the school closures, the extended school closures, the extended screen time has exacerbated that entire situation. So this mental health, it's a real crisis for our young people.
One of the other fallouts, gratuitous observation, of the pandemic was everyone is noticing that the public has lost confidence in traditionally accepted authority figures, resources, mm-hmm, for our communities. Specifically, things like public health. Specifically, when you mentioned something I found fascinating here, it seems like a great institution, and I think CHOP is a great institution, speaks with many voices. I wish they would speak to each other, because there is a show, one of our earliest shows on COVID in the summer of 2020, where Paul Offit is saying, mm-hmm, we've got to get kids back, mm-hmm, in school. Clearly, Professor of Vaccinology at CHOP is saying we got to get kids, mm-hmm, back in school. But I experienced the same thing. I would see the policy lab making statements, and you just tell me the science. Help me understand that. Controversies between people is okay, because that's how we find the truth. We differ, we argue, we trade ideas back and forth respectfully, mm-hmm, and we use numbers but it's terrifying when you don't see this dialogue being played out. I would have loved to have Dr. Offit and somebody from the policy lab speaking together, mm-hmm, so they could get on the same sheet of paper. Sorry for that digression. Mm-hmm. Did all the school districts around Chester County and the main line, did they all respond to the same way with closures?
So in southeastern Pennsylvania, so I'll include the collar counties, Chester, Montgomery, and Delaware County, they all responded fairly similarly. And I'm leaving Bucks out of the equation for the moment. Chester County, I liken it to, we were in hyper lockdown mode. The director for the Chester County Department of Health Gene Franklin took a very, very hard line that schools should not reopen. They started off as hybrid. You couldn't have more than a certain number of kids in a classroom. You needed the 6 feet of social distancing. Everybody had to wear a mask. Wednesdays were deep cleaning days. She bought the CDC's recommendation hook, line, and sinker. And while she kept saying that it was just guidance, she had no authority to do anything, every single superintendent in Chester County followed her guidance as if it was the Bible. And what we now know as a result of this report from the U.S. House Committee is that it's all bogus. Fauci admitted that the 6 feet of social distancing was some made-up number. It was not rooted in science. Same with the masking. So everything that she perpetuated on our children, forcing them out of the classroom, was all a bunch of BS. And it's unfathomable to me that she remains in her position to this day.
I guess that means no job recommendation if she ever is.
Not for me, Frank, no.
I don't know if you were on with me. I was involved way back, this was back in 2020, in a conference call that was involving some mixed group of educators.
Yes.
I made the comment that when you took, because the American Academy of Pediatrics in their summer position paper of 2020 said 6 feet would be nice, but you don't keep schools closed if you can only do 3 feet, which there is no reason for 6 feet, and I've always argued that. We both know that. But I remember making the comment that when you took the separation between desks from 3 feet to 6 feet, you quadrupled the area of exclusion.
Correct.
And I remember one of the people on the, those awful screen conversations said, "No, you just double it." And I thought, hold it, you're in education. You're missing the fact that the area is R squared. Not it's 2 squared. It's 4.
Right.
You and I was just it's the pandemic told us a lot about ourselves that we're still trying to either ignore or we haven't come to grips with it. Why do you think what happened in Bucks County?
So in Bucks County, they actually had a health department that was led by an actual physician. Imagine that. Chester County's health department continues to be led by someone with a public health administration background, not a physician. And yet in Bucks County, they had a physician who pushed to open schools, to minimize the amount of social distancing that had to be done and minimize the mask wearing. So he knew, because he was an actual doctor, what would work and what was just bunk. And we saw a very different outcome in Bucks County because those schools opened sooner without the same level of restrictions that we dealt with in Chester County.
I think that we started out, one of the things is we'd like to learn from this so that we can do things differently. Doesn't seem to be controversial. Have you sensed at all there is an interest in examining what we've done in the county at any level, at any location?
No, I do not believe that to be true. Particularly Chester County actually paid, I think, $144,000 to have an after-action report prepared analyzing their response to the pandemic. And it was not available publicly to anyone. I had to submit a right-to-know request to get a copy of both the actual report and the contract and how much was spent to do that. So the idea that Chester County is interested in transparency does not, to me, seem accurate, because they paid all this money for this report and they didn't do anything with it. They didn't share it with the people who paid for it. And honestly, the report wasn't very well done. There wasn't a lot in there. There were recommendations in there about some things that they could have done differently, but they really didn't address the school closures and the health department's very, very significant role in keeping those schools closed for a significant period of time.
The willingness to look hard at what we've done that may have not been the best, with best of intentions, but not the results we wanted. To understand the process, how we got to there, I think is critical going forward. I am disappointed there has not been any outside groups, outside of government, who have looked at this. However, I think that we've seen that some government people at the highest level have looked at this, and I think this is going to be good for another show, is to look at some of the actions that have happened there. But going forward, what can we do to start a dialogue with the region, with the county, so that we're not here to get scalps. We want you to grow.
Well, and so Frank, I have a little bit of a different opinion on that, because I think that a year or two after the pandemic, I would be comfortable saying, yes, it's time for us to learn from this and to use it as a learning opportunity. But 4 years later, when nobody is critically looking at what happened, it is time for us to hold people accountable for the bad decisions that they made. And I mean that sincerely. In Chester County and in every other, Delaware County started their own health department. They didn't even have a health department. They contracted with Chester County Health Department. Chester County is raising their taxes 13.47%. The commissioners voted, I believe, affirmatively this morning to approve that. Delaware County, I think it's a 23% tax increase. And these health departments are expensive. They're expensive to run and expensive to operate. Delaware County managed just fine without their own health department for how many years? And now they're raising taxes 23% and are supporting an entire new department. Chester County, our health department, epically failed our citizens at a time that it was most dire. And for the first year or two, I could agree with you and say, okay, it was a learning process. Nobody knew what to expect. People had the best of intentions. But I don't believe that these were the best of intentions, Frank. I believe that people acted in a politically motivated way that had nothing to do with public health and everything to do with a party line on how things should be handled. And therefore, I think that people should be held responsible and accountable for the mental health crisis, for the academic crisis, for this exponential child abuse that we saw during the school closures, the rise in transgender identification as a result of kids being locked away at home and watching social media for hours and hours and hours a day. I believe that people need to be held responsible for what we're dealing with.
We need also to remember that at one time, Chester County did have a physician, not the head, but a part-time physician who was double-boarded in internal medicine and pediatrics. And I believe that in July of 2020, she left the health department over a disagreement about informing patients that the COVID antibody test that they were given was meaningless.
Right.
And until the Inquirer broke the story, there was a reluctance, a definite conscious reluctance to acknowledge what had happened.
Absolutely.
Doesn't seem like responsive to the people with transparency.
No.
It's got a lot of credibility.
No, I agree.
You said pandemic's closed, but in some ways you've just shared with me the pandemic's ongoing, the sequelae to it. What has followed it, the generation that we have run over, yes, along with some rather interesting responses. One of the things that we saw was a lot of money was pumped into the economy with the best of intentions, trying to get people through the bad times when people were not going to work. But that created an inflation. I'm amazed at the basic economics 100. Inflation occurs when the money supply increases more than the increase in goods and services. If I put more dollars out there than there are an increase in goods and services, you're going to have inflation. We are still having that consequence. Now that we're down to about, 2.2% inflation, something like that. It's a lot more than it was in 2020, that's for sure.
Right.
Is there anything, do you sense that this has in some ways exacerbated the friction that we have between different groups in society? I like to think that there was a time think back to the time after 9/11 when we were gentle, kinder, we were courteous on the highway, we were toned down a bit. Now, this seems to have been the un-9/11 effect on society. People are more angry with one another. Maybe this is my confused observations. Am I just
Oh,
imagining
no.
things?
I think politically our environment is so charged right now. I mean, the recent presidential election is making people crazy, women shaving their heads, vowing that they're never going to have, sex for the next 4 years. So I think that we are living in a very, very hyper warp of political tensions between parties, between people with differences. And I think that a lot of that stems from the politically motivated actions. Health professionals should not have political motivations. And here we see that Dr. Fauci, at the head of our, public health for the country, had political motivations and acted in a politically motivated way. So when you see those actions happening, it becomes your trust in public health goes away. I personally have no trust in the CDC, the Chester County Health Department. I don't believe anything that they tell me because they have shown me that they are not reliable sources of information. They are unwilling to question any information that they put out there, and they're not basing anything on science or evidence, and they've admitted that. So why would I trust that information?
Would you feel better if they started a dialogue, a respectful dialogue with people? One of the more frustrating things I found is that when people have like Pilate, Pontius Pilate, quote, "Scripsi, what I have written, I have written. This is it. Shut up and follow orders." I don't ever remember. This seems to be just something that's happened recently, that we've adopted this authoritarian approach to participating in society.
I think with the right people, we could absolutely have a dialogue. Fauci is not capable of having a dialogue. He's not going to talk with anyone. And I don't think that our current health director in Chester County is capable of actually having dialogue with anyone. So if there were new people who were reasonable and smart and willing to listen to opposing and different ideas, I think that a dialogue would be incredibly helpful. But until we get to a place where we have people in charge that actually value communication and value differences of opinion and looking at the science and the evidence, until we get to that point, I don't think the dialogue is possible.
And I think that goes throughout our country right now. There are some areas that I see remarkable give and take, not banter, but give and take exchange of ideas that you go, wow, that's really incredible. But it's almost as geographical. It's all over the place. And in some ways, I don't think it's necessarily party driven. I think it's just culture driven. And we get these microcultures that some places understand that we make progress by respecting and listening and asking questions back and forth.
I do think that geography has a lot to do with it as well. Even here in Pennsylvania, Frank, the way that southeastern Pennsylvania operates is incredibly different than the way that the rest of the state works. You asked about, different school districts and how they handled things. There are school districts outside of this area in the central and western and northern part of the state that they opened that fall of 2020 on day one for full-time instruction without masks, without social distancing for any student that wanted to show up in school. And they didn't have an outbreak. They didn't have people dying.
No.
They opened school and provided a normalized experience for kids, which is night and day different. Out here, we had teachers showing up in full PPE gear. Imagine how frightening that would be for a kindergarten student to walk in and see their teacher, dressed like some alien from outer space because they were so irrationally afraid of catching a virus that probably would get them sick for a day or two. But that was our health department telling them, people are going to die. You're going to kill somebody.
The day down for cleaning. We
Right.
got to deep clean the classroom.
Right.
Geography. Is there a school district that we share with Berks County to the northwest?
Oh, yeah. So Twin Valley School District is partially in Chester County and partially in Berks County. And remarkably, they followed the Berks County guidance, not the Chester County guidance, and they too opened for full-time instruction. And when I asked at the time the Westchester, because that's where I live, superintendent, he said, well, they're partially in Berks County, so they can follow that guidance. And I said, well, you can follow whatever guidance you want to follow. You could follow Berks County. Go, well, we're all following our health director's guidance. Because I kept asking them, why aren't you doing what, Bucks County is doing? Well, that's Bucks County's not Chester County. Yeah. Meanwhile, yeah, anyway.
Yeah, it's a geographic thing, and they leverage the fact they're in Berks to have a different approach.
Exactly.
Well, more to come. Thank you very much for being the guest today. More importantly, Beth Ann, thank you for being Dr. Rosica. Thank you for being the reason-carrying voice that our community needs, especially for the marginalized, especially for the children who are somewhat voiceless. Thanks again for watching The Doctor's In, and stay safe out there.